I'm CEO of Nova Insights, involving consulting in really health tech innovation and strategy, and what I call humanizing digital transformation. Before that, I was a dreaded vendor, having invented a communication platform for providers and patients. And one of the areas we dealt with a lot was actually in women's health, particularly in the Veterans Administration, dealing with women's health and maternal health. So I have a particular interest in this area. So really excited to hear everyone's thoughts. So we're honored to have with us is Michelle Hoy, who is the Senior Vice President of Clinical Operations at Ellipsis Health, and Chris Lee, who's the Technology Strategy Director for Elevance Health. So very quickly, Michelle and Chris, why don't you introduce yourselves and we'll jump into it. So Michelle, why don't you go first?
Hi, thank you so much for having me today. As you just heard my name and title, I'm a mental health therapist and a substance use disorder therapist by training with many years of experience. I've also been a leader executive within specialty behavioral health provider and integrated care organizations, and have been with Ellipsis for about a year now, and I'm very excited about the work we're doing.
Oh, fantastic. That's great. Thanks, Michelle. Chris?
Hi, everyone. Honored to be here with you today. I'm Christopher Lee. I'm a technology strategy director at Elevance Health, which is a new name for Anthem. Prior to this, I've worked in various provider organizations as well as health IT startups. At one point in time, I thought of getting a PhD in clinical psychology and going down that path, but life takes you in unexpected directions. Certainly, mental health is still a passion of mine. So honored to be here.
That's fantastic, Chris. Thanks so much. So Michelle, let's start with you. So what is it you're doing at Ellipsis Health, and particularly in the mental health area, and obviously dealing with the topic of pioneering the change of the standards, because it is evolving quickly?
Yes, at Ellipsis Health, we are using natural voice samples and deep machine learning artificial intelligence algorithms to identify depression and anxiety symptoms and the severity of those symptoms. We really believe, and we know through lots of research and data, that mental health problems are on the rise in our country and quite frankly around the world. We know that it takes today way longer than anyone would like to identify and then treat depression and anxiety. People really suffer with these diseases, and it affects their overall health as well as their productivity at work, or their ability to be a really present mother or father, or sister, brother, husband, wife. It can really debilitate people in their entire life. So the sooner we can identify people and screen them and get them into treatment, we know will be better for everyone. And so we're trying to think about how we really equalize the playing field with physical health and mental health. When you go to a doctor, you get lots of physical health screenings, a blood pressure, a weight, all these basic things that give you a score, a data point. And that doesn't really exist for mental health right now. So really pioneering and thinking about a standard screening and a vital sign that makes it common and less stigmatizing, that every time you see a doctor or are talking to your insurance company or dealing with your health, that we are getting a glimpse into whether you might have one of these common conditions and can really start a pathway to help people.
That's really cool. And stigma is such a big issue in the area of mental health. Again, so the work that we've done, it's just amazing, and particularly in the military. It's a big issue area, particularly the military, and a lot of reticence to talk about it. So there's obviously a lot more to dig down there. But first, I want to just jump over to Chris. And obviously, we know mental health is an important area, but what particularly do you see as why it is so crucial to focus in on that area?
Yeah, I think first I would want to echo Michelle's point about the rising prevalence and incidence of mental health conditions, especially since the pandemic, since the economic downturns, uncertainty. But certainly it's not just something that has risen the past couple of years. I think there's just more conversation. It's becoming less stigmatized. So people are talking about it in terms of mental wellness, mental well-being, instead of purely depression, anxiety, or even more severe psychiatric disorders, right? Now, I think it is a rising issue, especially among kids. There was a recent U.S. Surgeon General advisory around the impact of social media on preteens, teenagers. We know that people, especially teenagers and young adults nowadays, are connected to their devices throughout the day. I think there's some statistics around checking it, 100 times or more a day, right? You're being constantly glued to this metronomic dose of negative news and comparison on social media with others, and then all of this stuff that really affects one's self-esteem, one's vision and hope or lack thereof for their future. So yeah, I think at a societal level, those, we do see that rising prevalence in mental issues and incidents. Now, on a more personal level, I myself have had friends and loved ones who have dealt with severe depression. I have lost somebody to suicide. I know many people who have gone through severe bouts of anxiety, whether it is general anxiety or it's, because of grief or something specific in their life. And I would bet that most of the audience here, you probably have known somebody, perhaps yourself, who have wrestled with mental issues as well. And if you don't, you're probably not paying enough attention.
Interesting insight, because there's no question the prevalence is considerably larger than I think even the statistics are telling us. But yeah, it was really interesting when the Surgeon General came out yesterday with that warning about social media tied to that. That it's going to be very interesting to follow that effect it has as it echoes through the system itself. But again, and putting all those pieces together, and Michelle couldn't help but notice the slogan for Ellipsis now, or has been, pioneering a new standard in mental health care by harnessing the unique power of human voice and AI. You sort of talked about that earlier, but really, what is that new standard? Like, how, obviously AIs, everyone knows about AI. We're all experts now in the past 3 months since ChatGPT came out. But what is that standard you really are zeroing in on, and that value proposition?
Yeah, the standard for us is really, again, that equalization of universal screening for mental health, not when we happen to think about a PHQ 8 or 2 or 9 screening. We also know that those forms of screening are laden with problems. They are often administered incorrectly. We know we have chronic under and over reporters. There are cultural and educational factors that can affect a person's responses. And we really believe that the sooner we can identify people who are struggling and get them some help, whether it be therapy or mindfulness skills and online or in asynchronous tools, the better off we and our world is going to be. People really do struggle with these things, and breaking down those stigmas and making it a common touch point that people aren't afraid to talk about, aren't afraid to know a score, can talk about. We all know what a healthy blood pressure is. Let's know what a healthy depression and anxiety score looks like. And if you're elevated, it's okay. Here's the resources to manage that. Just like when you have high blood pressure, we don't blame people. We don't judge them. We give them the resources to get better. So that's the kind of standard we're looking for, which is to elevate this, destigmatize it, and make it universal in terms of screening.
That's actually great perspective in terms of just, by phrasing it that way, we know our blood pressure, why not just that, the mental health scores, and just, it's part of every day that we all live with that. That's really kind of cool.
It would be wonderful if we all had that.
Yeah. Well, let's start it. Let's see what we can do. So, Chris, in terms of, obviously talking about where mental health is today, the tools, and obviously some of the standards as Michelle articulated, and where do you see it? So now where do you see it all going? Like, we got it today, and again, as I said, we're all AI experts, but where do you see it going tomorrow and the next day?
Yeah, that's a great question. I would say, I would distill it down to 2 things. Now, the first, we've been talking about it, mental health versus physical or medical side of services, right? And there's been a lot of talk and action in integrating behavioral health into medical settings, especially into primary care settings, so that you can identify those issues that may affect one's well-being, whether it is mental or physical. I think a lot of the conversation, however, has still been stuck in how does mental health or issues, how does that affect one's ability to, let's say, be adherent to their medication or treatment plans? Is still very focused on the physical health. I think where it's going is really treating mental health as its own thing, but in it really truly integrating it into it, and not just being secondary to the medical services side. And the second point I want to focus on is really, you can think of it as triage, getting the right level of support for the right individual. As we know, there are just not enough clinicians, mental health clinicians, therapists, psychologists in the world, right? Even with all of these startups that are marketplace based, they're just taking the same physicians and moving them back and forth. The supply is very much limited. But not everybody needs to see a psychiatrist. Not everybody needs to see a nurse practitioner or a psychologist or even a LCSW or an MFT, right? There are people who just need some level of peer support, non-professional or quasi-professional mid-levels. And I think having the right level of support for the right individual is where we need to get to in order if we want to treat the population as a whole and not simply people who have the best insurance or can pay out of pocket.
So really, what we're talking about is precision medicine and mental health for each individual, so each treated by their own standards in terms of what their particular needs are, which is makes so much sense. And of course, there's so much more I'd love to unpack, but looking at the clock, we're running down quickly. But I really want to have, what are you sort of, and Stan had asked in the previous session, but for each of you, very quickly, sort of your parting thoughts in terms of just, this is, where do you, to me, it's like, what do you see is the biggest issue that you think actually will be solved? And that you're most excited about in solving? How about that?
Well, I'll quickly say, I just really appreciate and love what Chris just said, which is that not everyone needs formal intervention or licensed practitioner interventions. There's so many opportunities. Again, like a blood pressure, not everyone needs a full-on dietitian one time a week for 12 weeks, right? Like there are online resources. So starting to really change our understanding of how mind and body is connected, getting comfortable with a score, a data point, and starting to culturally become comfortable with lots of options for people to manage their mental health and their overall health is what I'm really hopeful about.
Very, absolutely. And Chris?
Yeah, I think to sum it up, I like that word hope. I think that is what we really need, at this point in society here. Part of it, I think if it becomes more of a universal thing, getting people the right level of care, that in itself would help to destigmatize what mental health is, or mental health, seeking mental health care, right? Because I think the stigma comes from historically people go and the very institution, they go see a psychiatrist and it becomes this big ordeal. But if it's, hey, you can go see a therapist, you can see a marriage and family therapist or some peer support, non-licensed professional, then that would open up the conversation, especially as more, it opens up how many people can be served, and therefore it allows that to be a normalized thing within society, rather than, hey, whispers of knowing somebody, one person in your neighborhood or in your company or in your church who is seeking care, right? If everybody has some level of support, I think that's what moves destigmatizes and moves the conversation forward.